healthcare champions from industry, academia, health systems, patient advocates, payers, in the government, students, welcome to the 4th Annual Medical Innovation Olympics. My name is Mikhelashvili. I'm CEO and co-founder of Amedea Pharma, an agency that's bringing sports and data science into daily operations of all business. I am proud to support this unique shared experience and the Olympic spirit that we're replicating as closely as possible every year. I want to thank our extraordinary group of executives on our board for continuing to inspire each other, as well as to prove that it is possible to drive innovation forward by gathering together a group of leaders that do not normally interact with one another, as we have done in this community today at this opening ceremony. This year's theme is Layer the Science, Leap with Defiance. As the healthcare industry is learning from the tech experts on how to stack many different models in order to cumulatively drive performance of solutions that we bring to patients. Innovation takes place over different stages. It evolves horizontally as we master performance in order to ultimately drive consistency before we replicate our results and have vertical innovation. Every small step matters, and the power of these incremental progress that we make is illustrated by Lorne Whitehead, a physicist who in 1983 demonstrated in his experiment that a domino the size of only 1 centimeter can knock down the next piece that's 1.5 times greater when acted upon by momentum. And after 29 such events in succession, it can perpetuate a structure the size of the Statue of Liberty to fall. Innovation is flourishing today. It is challenging to implement, however. In fact, it can be said that the healthcare environment is hostile to innovators in many regards. And so we have to leap with defiance before we scale vertically. We have to defy those doubters among the HCP community and patients who do not believe that the current technology will improve, but actually it may worsen healthcare. However, we are now visualizing neurocircuitry with functional MRI scans that we have never been able to see. We only dreamed of years ago. We have blood-based biomarkers that are allowing us to detect Alzheimer's earlier. We're conducting heart transplant surgeries completely with robots alone. We have wearable devices that are now setting new unprecedented standards of treating some of the most aggressive forms of cancer, such as glioma, brain cancer, or non-small cell lung cancer. When you ask its executive chairman, William Doyle, however, that journey was also wrought by a lot of unprecedented challenges, and it was quite harsh. It took 24 years for Novocure to bring this to patients. And so humans, by nature, we are resilient, and also we're innovative by design. Isaac Newton wrote his laws of calculus and gravitational theory during the London plague. Not only are we able to overcome, but we celebrate challenge. We all have clear images in our mind when strangers sang in unison in balconies during COVID, even though they didn't know what the next day would bring. And so even though humans are resilient, today we have to be more responsible than ever, because the leaders of the most very well-known AI platforms that we're all familiar with, Nobel Prize laureates and experts themselves recognize that they do not often understand how the performance metrics can be predicted of these models. And so innovation in medicine is delicate. I compare it to trying to build a highest tower using Jenga blocks, where you have to have that leap of faith until you make that final block that you stack up on that tower. And so as much as I am enthusiastic about innovation, we need to be just as enthusiastic about our governance of the technology for our patients, for whom the difference may be between life or death. Because we have to be the ones to decide if and when to stack that last block, or perhaps to start a new foundation adjacent to it in order to make it stronger and taller as well, ultimately. This event is inspired by the Olympics as well as unique competitions in different fields. The Queen Elizabeth competition in Belgium of classical music, as well as the Sanremo Festival in Italy of modern music, they both require competitors to present and perform the same piece of music over consecutive different nights. This allows our expert judges to determine that small, minimal edge that may determine the difference between these high performers. And also, it allows us to see how they react to tension, to challenge over time. So our competitors here are going to transform from leaders and scientists in medicine to performers as well over the next 16 days. But whether or not you will win the top concept or top product prize, other special recognitions, whether or not you compete or you attend this event, the goal of the 2025 Medical Innovation Olympics is for you to leave feeling like true champions in healthcare, ready to address any challenges ahead. So with those comments, I'd like to invite our leaders, some of the leaders in the board and expert judges, to make very brief comments and to welcome our audience. Melissa.
Thank you. I am thrilled to be here, and I cannot wait to see how we all collectively level up to the challenge. I think it is an extraordinary opportunity to lean in when the challenges are big, to figure out how we can get past them as a group and individually. It brings out the best in you all, and also gives you a peer group that can encourage you to be and do the best that you can do. So I can't wait to find out what this event will bring this year. It's always extraordinary, and I can't wait to be a part of that.
Thank you. Thank you. Eddie Power.
Thank you, Tim. Eddie Pass here on Paramedical, a consultancy focused on medical affairs and medicines development in pharma. Really excited to be here today and over the next coming few days. I'm always interested and invested in the power of learning and that curiosity that helps us all develop and grow better as we move along. So really looking forward to hearing from all the speakers, the panelists, and of course, all our competitors, and really look for that innovation and what they're really thinking and bringing to the table to help improve patients' lives at the end of the day. So very excited to be here. Also looking forward to all the networking. I'd encourage all of us to network and just bounce ideas off each other, and we'll make this something that's truly memorable. So thanks, Tim, for having me.
Thank you. Thank you very much for your support. We're also partnering with New York Bio, whose CEO, Jennifer Hawks-Bland, is on the train, and she may be joining us later to also make some comments to introduce herself. We're very proud of that partnership with this organization.